Hello everyone, Rita this side. Welcome back to Medicine Esic. Today we came with another new session of pregnancy complications that you can see on screen, that is hypertension in pregnancy, or else we can say it as pregnancy induced hypertension. What is the meaning of pregnancy induced hypertension? So in that name itself you can understand hypertension that is induced or occur or happen because of this pregnancy, that is called pregnancy induced hypertension. So today we start this first class of PIH, where we will be discussing the basic introductions of PIH. We will discuss in detail about classifications of all PIH, okay, and then the risk factor. Today we will be discussing only this much, and I request everyone to listen this class till the end, because when we will give management to the pregnant mother, that management is fully depend on the type of hypertension mother is having during pregnancy. So the management is completely based on which kind of or which class of hypertension mother is having. So listen this class till the end, otherwise you will be having confusions in further step. So before we jump onto our today's topic, that is PIH, we should know what is hypertension. So if I break down the meaning of hypertension, so it will be like this. Tension means pressure. Okay. Which kind of pressure? Blood pressure. Blood pressure means this blood vessels will get some kind of stress or pressure, that will call pressure or tension. And hyper, that is elevated, more than expected. So elevated blood pressure is called hypertension. Okay, we are simply write it down like HTN, hypertension. Now when this blood pressure is 120 by 80 mm of Hg, we are calling it as normal blood pressures. Okay, now when the blood pressure is more than 120 by 80, we will call it as hypertension, that means elevated BP. Okay, when the blood pressure is less than that, less than 120 by 80, we will call it as hypotension. So hypo means less and hyper means more BP and less BP, that is called hypertension. So if you see this, let's assume this is a normal blood vessels. Okay, normal blood vessels. Now inside that blood vessels, this blood is freely moving and going to the major organs. It's supply the blood to major organs, to all body cells and tissue. This is blood vessels, healthy conditions. Okay, now let's assume if a person is having hypertension. Okay, so what will happen in case of hypertension? In case of hypertension, this blood vessels will be constrict or narrowing. Okay, constrict or narrow. ठीक है? So if this blood vessels become this much, that means constrictions or narrowing occur, then less amount of blood will be reaching towards the body cells. That's what is happening to the persons who is having hypertension. So hypertension simply meaning is that constrictions or narrowing of the blood vessels. Normal condition में क्या होता है? Normal conditions में blood vessels is freely or in less relaxed or in more relaxed state. But if a person will be having hypertension, then these blood vessels will be constrict or narrow due to stress or pressure, due to stress or more amount of pressure, and that will create these blood vessels like this, constrictions or narrowing of the blood vessels. As a result, less amount of blood will be flowing. Okay, less amount of blood will flow. This is the meaning of this hypertension. Now when we are talking about this hypertension in pregnancy context, okay, hypertension, if we are considering it in pregnancy context, we will call it as pregnancy induced hypertension. Okay, so when these hypertensions occur in pregnant women, we are calling it as PIH, pregnancy induced hypertension, or hypertension in pregnancy. Okay, so what is the meaning of hypertension? We will be knowing this. So PIH, ठीक है? First, we will know the definitions of PIH. So, what is PIH or pregnancy induced hypertension? So, the definition is when this BP will be, blood pressures will be more than 140 by 90 mmHg on two separate occasions of 4 to 6 hours apart. ठीक है, means the systolic blood pressure is more than 140 and the diastolic blood pressure is more than 90 in pregnant woman. और क्या होगा? This PIH will be detected when detected after 20 weeks of gestation. और क्या फीचर होगा? Pregnant blood pressures will come normal after delivery. Okay, so the meaning is this pregnancy induced hypertension means mother was normotensive before. Okay, mother was normotensive, that means normal BP. Now, mother conceived, pregnancy occurred. Okay, pregnancy started. When pregnancy is after 20 weeks of gestational age, new onset hypertension occurred. Mother came to you, you check the BP, you got high blood pressure. Again, you told mother to sit for 4 to 6 hours and you checked again. Again, if you get high BP, that means in two different occasions you are getting this 140 by 90 mm of Hg blood pressures or more than that, then you will consider that mother is having PIH, new onset of hypertension occur, and that is called pregnancy induced hypertension. Okay, so this is all about the introductions of PIH. Now, जरूरी नहीं है कि हर मदर को 20 weeks of gestation में ही BP बढ़ना स्टार्ट होगा. So we will classify this hypertensive disorder in pregnancy in detail. So first of all, when a mother come to you for antenatal visit, as a nursing officer, it's your duty to check the mother's BP. Now, there will be two kind of mother who can comes to you. One will come before 20 weeks of gestations. Okay, and let's say one mother come after 20 weeks of gestations. Now, you already know कि in two kind of cases, if somehow mother will be having high BP. Okay, here also you got high BP, here also you got high BP. What will be the BP? More than 140 by 90. Okay, more than 140 by 90. Here also you got more than 140 by 90. So, I told you, if high BP occur more than 20 weeks of gestations, then it will consider as PIH. So, here I will consider it as pregnancy induced hypertension. Why? Because mothers will be having high BP after 20 weeks of gestation. That's why this will be considered as PIH. Now, in definitions, I told you PIH means mother was previously normotensive. Now, after 20 weeks of gestations, then mother is giving the history of high BP, then it will be considered as PIH. If mother will be having high BP before 20 weeks, whether you will call it as PIH? No, this is not PIH. Okay, remember, this is not PIH. Then what it is? It will be called as chronic hypertension. Okay, so what is the feature of chronic hypertension? So the feature will be majorly we are classified this hypertension in pregnancy in two class. One is chronic hypertension and another one is pregnancy induced hypertension. Okay, so what is the meaning of this chronic hypertension? Chronic hypertension means patient or mother has history of hypertension, okay, before pregnancy. So then here the feature will be in PIH, patient or mother was normotensive before pregnancy. Okay, that is PIH. Now second thing is BP is in increasing state throughout pregnancy. BP, in case of PIH, BP will start increase when? After 20 weeks of gestations. Okay, gestations. Acha. BP will still high after delivery. But in case of PIH क्या होगा? BP will come down to its normal stage after delivery. So listen carefully. Classifications of hypertension in pregnancy are majorly classified as chronic hypertension and pregnancy induced hypertension. So what is chronic hypertension? If mother is having elevated BP before 20 weeks of gestations, mother is already suffering from hypertension, mother is having high BP before 20 weeks of gestations, that means mother is somehow taking blood pressure medications. Okay, and it will be increasing throughout the pregnancy, in first trimester also, second trimester also, third trimester also, even after delivery also BP will be still high. But in case of pregnancy induced hypertension, in that definition itself you learned that BP mother was normotensive means normal BP when? Before pregnancy. When it start to increase till 20 weeks, it will be normal. It will start increasing after 20 weeks of gestations. Okay, then again it will come down to its normal stage after delivery of the baby. That is the definitions of PIH. So you understand the difference between chronic hypertension and PIH. Chronic hypertensions occur before 20 weeks, from before 20 weeks onwards, and PIH occur after 20 weeks of gestations. So this is the major classifications. Now I will further classify this PIH. I will further classify it PIH into some other categories. Okay, so the first category is PIH further divided into gestational hypertension. Okay, another class is preeclampsia, then eclampsia. Okay, then chronic hypertension with superimposed preeclampsia. Now it sounds like bit confusing, but I will clarify one by one. So PIH, whole hypertension in pregnancy, was classified as chronic hypertension and PIH. Again, PIH further classified as gestational hypertension, preeclampsia, eclampsia, and chronic hypertensions with superimposed preeclampsia. Okay, so we will learn one by one. What is gestational hypertension? Remember, here only mother will be having high BP. Other than that, nothing else. Okay, so only high BP, more than equal 140/90 mm of AHG when? After 20 weeks of gestational age. और कुछ रहेगा? No, nothing else. No proteinuria. Okay, no proteinuria. और कुछ रहेगा? No organ damage. Okay, no end organ damage. Remember, due to this hypertension in pregnancy, even mother will suffer with multiple organ damage, liver damage, kidney damage. Okay, vision can also hamper. So during hypertension in pregnancy, it's your responsibility to manage the mother. Otherwise, it will have impact on mother, fetus, placenta, everywhere. So this hypertension in pregnancy is very, very important. So PIH I further classified as gestational hypertension, preeclampsia, eclampsia, and chronic hypertension with superimposed preeclampsia. Now What is gestational hypertension? Gestational hypertension simply having high BP, nothing else. इस केस में मदर को बस हाई बीपी ही रहेगा और कुछ दिक्कत नहीं है. नो हिस्ट्री ऑफ प्रोटीनूरिया मीन्स इन यूरिन यू कांट फाइंड एनी काइंड ऑफ प्रोटीन. Even mother won't be having any organ damage. Okay, mother will be fine except this high BP. That's it. Coming to this preeclampsia. What is preeclampsia? Preeclampsia means here mother will be having high BP more than equal 140 by 90 mmHg. Everyone will be having more than 140 by 90 mm of Hg high BP. Okay, high BP. Along with that, one new thing arises, that is proteinuria. Proteinuria present. ठीक है, proteinuria present. End organ damage present. Yes, it can be present or cannot be present. Depending on that, preeclampsia will be further classified. So, end organ damage प्लस माइनस. ओके, प्रेजेंट रह भी सकता है और नहीं भी रह सकते. ठीक है, अगर प्रोटीनूरिया प्रेजेंट है तो कितना अमाउंट ऑफ प्रोटीन यू विल गेट फ्रॉम दिस यूरिन टेस्ट. ओके, नाउ just remember this end organ damage present or absent, depending on that further preeclampsia will be classified. That I will come later. Now coming to this proteinuria. Okay, so if you do urine test, okay, in urine test you will get more than equal 300 mg protein in 24 hours urine sample. So if you tell mother to collect your whole urine in a day in a big container and then you do the urine test, find out the protein, then how much protein you will get? You will get more than equal 300 mmHg. Okay, if you just do random urine test, okay, by taking one urine sample, not whole day's urine sample, if you do random urine sample test, okay, you will find out this protein more than equal 300 mg by dl. Okay, mg per deciliter. So if you check whole 24 hours urine sample, you will get more than equal 300 mg of protein. If you check random urine sample, if you do random urine sample test, you will get more than equal 30 mg per dl, and then you will tell mother that you are having proteinuria. Okay, proteinuria means presence of protein where? In urine sample, in urine. That is the definitions of proteinuria. Okay, so we classified this preeclampsia as well. Now coming to this preeclampsia is further classified. We will further classify this preeclampsia as mild preeclampsia, okay, and severe preeclampsia. अब देखो, माइल्ड प्रीएक्लेम्सिया और सीवियर प्रीएक्लेम्सिया में फीचर तो दोनों सेम रहेगा. मीन्स बीपी विल बी हियर ऑल्सो मोर देन इक्वल 140 by 90 mm of Hg, but he less than 160 by 110. Okay, 110 mm of Hg. In case of mild preeclampsia, BP will be more than equal 140 by 90 mmHg but less than 160 by 100 mmHg. So severe preeclampsia में क्या होगा? Severe preeclampsia में BP will be always more than equal 160 by 110 mm of Hg. Remember, now proteinuria दोनों में ही present रहेगा. Proteinuria present here also, proteinuria present. Now again, end organ damage absent here, absent in case of mild preeclampsia, that's why it is mild. But in case of severe preeclampsia, end organ damage present. Okay, so preeclampsia, this is preeclampsia means BP will be more than equal 140 by 90 mmHg, proteinuria present, end organ damage can be present, can be absent. Now this preeclampsia further classified as mild preeclampsia, severe preeclampsia. Mild preeclampsia means BP will be more than equal 140 by 90 mmHg but less than 160 by 110. लेकिन severe preeclampsia में क्या होगा? BP will be always more than equal 160 by 110. This is too much high. Proteinuria will be present in both cases. Okay, here also, but in mild preeclampsia, no end organ damage, no organ damage history will be there. But in case of severe preeclampsia, as there is high BP, as there is proteinuria present, there will be organ damage also. So end organ damage will be present in severe preeclampsia. Now I'm continuously keep on saying end organ damage, end organ damage. So what is the meaning of this end organ damage? So there are some features end organ damage. What all are the features of end organ damage? Okay, the first feature is, remember, liver enzymes raised, liver enzyme raised to more than equal 2 times. Okay, so liver enzyme means ALP. You do LFT test, right? Liver function test. So ALP means alanine, alanine transaminase. Okay, और क्या होता है लिवर एंजाइम? AST, aspartate transaminase. ओके, और क्या होता है? ALP, alanine phosphatase. You check this LFT test, na? You do LFT test in patient. So this ALT, AST, ALP all are kind of liver enzyme and other enzyme also. So if you check this ALT, AST, ALP and other enzymes, this value will be more than 2 times of its normal value. Those are having certain value in normal range. When it will be increasing more than 2 times of normal value, then that means this is the indications of liver is getting damage. Okay, that is very severe. Now the second feature is, first end organ damage is liver enzyme increase. This is the signs. Okay, so the second one is serum creatinine more than equal 1.1. that means what? In normal female serum creatinine value will be 0.5 to 1.1. ठीक है, अब if it is raised more than equal 1.1, that indicates kidney damage. Okay, so this is also another threatening signs of end organ damage. Now coming to this third one is platelet count. Platelet count will be less than 1 lakh. So पहले normal value पता करो. Normal platelet count will be 1.5 to 4.5 lakh approximately. अब देखो platelet count severely decrease हो गया. That is also another signs of blood is having or our body is having less platelet count. ठीक है. Then another signs will be, this is third. Fourth, visual symptoms क्या होगा? मदर विल बी कंप्लेनिंग ऑफ ब्लडिंग विजन्स. ओके, कुछ भी अच्छे से दिखाई नहीं देगा, ब्लडिंग विजन्स. और क्या हो सकता है? डिप्लोपिया मतलब व्हाट? डिप्लोपिया मीन्स टू इमेजेस ऑफ सेम ऑब्जेक्ट्स. ठीक है, अगर आप किसी भी ऑब्जेक्ट्स को देखोगे तो आपको एक ही ऑब्जेक्ट्स नजर में आएगा. बट इन केस ऑफ डिप्लोपिया, मदर विल बी सीन एवरी ऑब्जेक्ट्स और इमेजेस in 2. The same objects will be seen as 2 objects. So the visual symptoms will be either blooding or diplopia. Okay, then pulmonary edema. ठीक है, so pulmonary edema means fluid will accumulate inside the lungs. Mother will be having respiratory problem. So all are the features of end organ damage. So features are liver enzyme raised to 2 times, that means liver damage. Then second one is serum creatinine value more than equal 1.1, that indicates kidney damage. Then platelet count will be less than 1 lakh. Visual symptoms will be seen either blooding vision or diplopia, and fluid will accumulate inside the lungs, that is pulmonary edema. All are the features of end organ damage. Where it's seen it can be seen in severe preeclampsia. Can you see this end organ damage in mild preeclampsia? No, because in mild preeclampsia, end organ damage is absent. Where it is present? It is present from severe preeclampsia onwards to further other classifications also. Now, so we discuss about gestational hypertension, we discuss about eclampsia, coming to this preeclampsia, coming to this eclampsia. Okay, so now this is eclampsia, the third classifications of PIH. So eclampsia means what? Eclampsia matlab this severe preeclampsia, when you can't manage this severe preeclampsia, then along with severe preeclampsia feature, mother will be having convulsions. Okay, this is another one threatening conditions, life threatening conditions of mother will be having this eclampsia. So what all are the features of eclampsia? Eclampsia will be having all severe preeclampsia's features, like BP will be more than equal 160 by 110, proteinuria will be present, then end organ damage present, along with that another new thing added, that is convulsions, seizure. Okay, seizure occur. Which kind of seizures mother will be having? Mother will be having generalized tonic clonic seizure. So this is the classifications of or features of eclampsia. I hope you understood how one by one these situations became dangerous. So this management is very important. Now the last classification is chronic hypertension with superimposed preeclampsia. Now in that name itself you can understood mother is having chronic hypertension. Okay, chronic hypertension means what? Already mother is having hypertension history. Mother is having high BP before pregnancy itself. Now mother conceived, mother's pregnancy started. The BP will be high throughout pregnancy. Along with that severe preeclampsia feature also started. Okay, so chronic hypertension with preeclampsia is coming under this class. Which class? Chronic hypertension with superimposed preeclampsia. ठीक है? Now we classified this whole hypertension in pregnancy into all classes. Now again, ताकि आपको और भी बेहतरीन तरीके से समझ आए, I will further classify it. Okay, shortly. Now hypertension in pregnancy. ठीक है, this is our today's first class pregnancy induced hypertension. और ठीक है, hypertension in pregnancy. अगर mother is having high BP before 20 weeks of gestation, we will call it as chronic hypertension. If mother will be having high BP after 20 weeks of gestational age, we will call it as PIH. So what is the difference between chronic hypertension and PIH? Chronic hypertension, already mother is having high BP before pregnancy. Mother was never normotensive, means mother is having history of hypertension. Throughout pregnancy, mother will be having high BP. Even after delivery also mother will be having high BP. But what is the feature of PIH? PIH means mother was normotensive before pregnancy. Then BP started increase after 20 weeks of gestations. It will come down after delivery. That is the definitions of PIH. Then further we classified this PIH into 4 categories. What are those categories? One is preeclampsia. The next one is, first category was gestational hypertension. Okay. Second category was preeclampsia. Third one was eclampsia. And fourth one was chronic hypertension with superimposed preeclampsia. Now again, so chronic hypertension means what? Chronic hypertension means BP will be more than equal 140 by 90 mmHg. Only BP will be high. Other features won't be present. Means absent proteinuria. कोई भी proteinuria present नहीं रहेगा यूरिन में protein. Absent end organ damage. Okay, end organ damage. Now, what is the features of preeclampsia? Preeclampsia is of 2 types. One is mild, another one is severe. ठीक है? Now, mild means BP will be BP will be more than equal 140 by 90 mmHg but less than 160 by 110. But in case of severe preeclampsia, BP will be 160 by 110. ठीक है? In both cases, proteinuria will be present. Here also, proteinuria will be present. So, okay. But end organ damage, in case of mild preeclampsia, end organ damage will be absent. Here, end organ damage will be present. End organ damage will be present. Now, what all are the features of end organ damage? End organ damage means liver damage. That means liver enzyme will increase more than 2 times. Kidney damage. Kidney damage means serum creatinine value will be more than 1.1. Then platelet counts. Platelet counts will be less than 1 lakh. Okay. Then visual symptoms will be either blurring visions or diplopia, and then pulmonary edema. Those are the features of end organ damage. ठीक है? Then again, this is preeclampsia mild form and severe form. Eclampsia means what? Eclampsia means this severe preeclampsia is now came here along with that severe preeclampsia. When we can't manage properly, along with that mother will be having convulsions, means severe preeclampsia plus convulsions, that too tonic-clonic seizure will be considered as eclampsia. And what is chronic hypertension with superimposed preeclampsia? That means mother was having chronic hypertension history before pregnancy, along with that preeclampsia feature also started. We will call it as chronic hypertension with superimposed preeclampsia. Now in next class we will be discussing how these convulsions occurs in case of eclampsia, eclamptic mother, how these convulsions occur. We will discuss about in next sessions. Now coming to our last topic of discussions, that is risk factor. So there are various risk factors which causes this hypertension in pregnancy. ठीक है? Now risk factors can be from mother side also, pregnancy related. Okay, pregnancy related risk factor. What all are the risk factor related to pregnancy? That is first pregnancy. Okay, first pregnancy. That means primipara mother, primigravida, not para, primigravida. Gravida means for the first time mother got pregnancy. Okay, para means what? For the first time mother pregnancy reaches beyond period of viability. Okay, that is parity. Gravida means for the first time mother got pregnant. So primigravida itself is a risk factor. Now multiple pregnancy. Okay, multiple pregnancy like twins, triplets, etc. Okay, so multiple pregnancy also can be a risk factor. Then H mole, hydatiform mole, that means gestational trophoblastic hyperplasia, another name. Okay, if maternal age below 20 or more than 35, all are the risk factor of this hypertension in pregnancy. Okay, then RH incompatibility, that also we will discuss in detail. Okay, all are the pregnancy related risk factor. Then maternal medical history. ठीक है? Okay, here also another one is previous history of PIH. अगर mummy is having first pregnancy with PIH, then that also be a risk factor for her second pregnancy. Now coming to this maternal medical history related, if mother is suffering with chronic hypertension, that can be a risk factor. If mother is having diabetes mellitus, can be a risk factor. If mother is having any kidney disease, that can be a risk factor. If mother is obesity, high BMI, okay, high basal metabolic body mass index. Okay, then family history. Okay, family history of hypertension or family history of preeclampsia, ठीक है, etc. Then coming to this lifestyle factors. What all are can be this risk factor? Like if mother is having high salt intake history, okay, then smoking, then stress, all will create a risk factor in case of pregnancy induced hypertension. So today we discuss about the introductions, we discuss about the classifications in detail, Okay, classifications will be chronic hypertension, then PIH, then mild preeclampsia, okay, severe preeclampsia, eclampsia, and the last one, chronic hypertension with superimposed preeclampsia. Okay, and the last one we discuss about risk factor. In our next class, we will be discussing about how these convulsions occur and pathophysiology. Okay, then sign and symptoms of this hypertension in pregnancy, because if severity will increase, the dangerous situations or characteristics will be seen in mothers. Okay, all will be discussing one by one in simple, easy to step. I hope this class is helpful for you all. Listen this class till this end. Make notes, because this is very much important for your upcoming exams. Thank you, students.